So first off, why did you feel it was important to do a whole separate policy position for this?
Well, as I've traveled around New Hampshire, the need for access to mental health care is a huge issue. And there is a correlation and a fundamental relationship between the opioid crisis and the lack of access for mental health in the state and around the country. And so the result is that if someone's suffering from chronic pain or mental illness or anxiety, if they don't get access to a mental health provider, they may turn to self-medication. It's something that can often drive addiction and really has played a role in the opioid crisis in the state.
So your plan has a lot of ideas in it. The one thing that's lacking a bit of detail is how to pay for it.
So these ideas actually bend the cost curve because about $440 billion are wasted a year in the cost of not having adequate mental health. And so if you are making sure you have 100% parity, that mental health is provided, increase your providers, increase access, and do it through Medicare For All, it's going to pay for itself. Medicare will be revised to cover everything, make sure reimbursement rates are accurate, and making sure mental health is covered with full parity.
So in your plan, you address, quote unquote, the tragedies of tomorrow. I'd like to hear a little bit more about the link between mental health and shootings that we've seen recently.
Yeah, so we have to ban assault weapons, the military-style weapons in the large magazines. We got to close the loopholes that make it so easy for someone who shouldn't have a weapon at all, any kind, can get them, including those who have grave mental illnesses with a violent tendency, including people on the terror watch list, including the boyfriend loophole, where someone who's abusing a loved one or someone in an intimate relationship, and you can't get a protective order against them, and you can't actually get their weapons taken away. That's the truth of why you need universal background checks, as well as federal anti-gun trafficking.
So for all of these expensive healthcare system overhauls and guarantees, and a lot of them you're addressing in your plan, how do you get states to that are already struggling with revenue to pay for these programs to be incentivized to change it?
Show them the nuts and bolts outcomes. Show them that what is the impact of this intensely high suicide rate? What's the outcome of the opioid crisis and the cost to their tax base, of how mental health affects treatments for other medical problems. If you have a mental health issue, you won't necessarily take the medicine that's been prescribed for your diabetes. If you don't take the medicine prescribed for your diabetes, you probably can't work. That's the truth of it. It's a huge drag on the economy already.
So you were also incredibly outspoken at the last debate about the firing of the officer in the Eric Garner case.
He should be fired. He should be fired now.
Yes. I'm curious for your reaction now that he has been fired.
I'm grateful that Eric Garner's mother and his family can have the smallest measure of justice. It's still the smallest measure, and it took way too long.
You also spoke this morning with the Daily, the New York Times podcast, at length about your decision to call out Al Franken to resign over sexual harassment allegations.
Yeah.
I do not feel that he should continue to serve. Everyone will make their own judgment. I hope they do make their own judgment.
I know you weren't the only one to do that, but you were the first. It seems to be a label that is stuck in a lot of ways. Is that frustrating? Are you discouraged by it, or do you still stand by your decision?
So with regard to Senator Franken, he had 8 credible allegations against him that were corroborated in real time. 2 of them were since he was elected, and the last one that came to light was a congressional staffer. And I had been working for a very long time on ending sexual violence in the military and on college campuses, ending sexual harassment in Congress, had just introduced legislation to begin to change how we deal with this process. So I just couldn't, after 8 allegations, continue to defend him, and I couldn't stay silent. As a mother of boys, having conversations with my oldest at home, when Theo said, "Mom, why are you so tough on Al Franken?" I had to have clarity and say, "Theo, not okay for anyone to grope a woman without her consent or forcibly kiss her without her consent. And it's not okay for Senator Franken and not okay for Theo." So I may seem like I stand alone. When I did call on him to resign, 34 other senators followed me, some within minutes, some were running for president. But I think it's something you have to have the courage to do. There is no prize for someone who stands up to a powerful man, who's good at his day job and is popular, but we should have the courage to do it anyway. It's the right thing to do.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.